Hello, my name is Karen Blake and I'm an Indiana State University nursing student. Today I'm going to talk to you about a population at risk, and that is those with poor oral hygiene. The learning objectives are: students will be able to list several health conditions caused by poor oral hygiene. Students will be able to describe the important steps in oral care. Students will be able to list other strategies to keeping a healthy mouth. Students will be able to give specific examples regarding differences between men, women, and children and their oral health needs. Students will be able to list some cultural barriers regarding oral health care. Students will be able to name some specific populations at risk. Students will be able to explain how often it is recommended to see a dentist for preventative care, as well as when we should be seen for dental issues. Please take a moment now to take the pretest in the link below. Good oral care is about more than just your mouth. Not performing the proper oral care on a daily basis can lead to more than just cavities in your mouth. Poor oral hygiene can lead to things like heart disease, diabetes, lung disease, oral cancer, bad breath, tooth decay, and gum disease. If you already have diabetes, mouth infections can cause inflammation and cause your blood sugar to spike. Better oral care can help keep your blood sugar under control. If your gums are inflamed with bacteria, that bacteria can go into the bloodstream, and once in the bloodstream, it can build plaque up in the arteries, and that can cause hardening there, which is what will lead to heart disease. For lung disease, bacteria in your mouth can actually get into your lungs and cause lung issues such as pneumonia. Everything that you do in terms of oral care is only going to help your overall health. Brushing your teeth properly should only take a few minutes in the morning and a few minutes at night. Make it a part of your routine and you will reap the benefits of feeling great, not just your mouth, but your overall health as well. You should choose a soft or medium bristle toothbrush. Anything harder and you could cause some issues with your gums, cause them to become inflamed and irritated. You should choose a toothpaste that has fluoride, and you should choose one that will suit your needs. Some people need a more sensitive toothpaste. Others would prefer to use a baking soda in there, kind of get their teeth a little whiter. Once you do that, you'll put that toothpaste on, and you are going to spend approximately 2 to 3 minutes and brush in circular motions across all surfaces. You want to make sure to brush in the back as well. Some people will recommend to start in the back so you don't forget that. So you're going to brush all the tops of all of the surfaces. You're going to go across all the tops. You're going to go across all the sides, go all the way in the back. And then at the back, you're going to go all the way around. And then you're also going to go then all the way around in the very back of the teeth. So you do that for 2 to 3 minutes. Make sure you're brushing in circular motions and you are getting all of the spots of the teeth. Then you can floss once a day. So if you are a morning person, you can floss in the morning. For a night person, floss at night. We recommend drinking water, especially in between meals. You can use a mouthwash for extra preventative. You could do that in the middle of the day if you wanted, or if you want to do it in the morning or at night instead. You can chew a sugar-free gum. And actually, we recommend potentially taking a video of yourself brushing your teeth to see how well you actually get all of the surfaces. I want to encourage you to make regular checkups and cleanings a habit. You should go to the dentist twice a year for preventative care. When you go to the dentist, you will have a dental hygienist, and he or she will get you to a chair and try to keep you comfortable while cleaning your teeth with specialized tools. Even if you have super oral care at home, they will still use specialized tools to pull off plaque and tartar and get your teeth even cleaner than you can get done at home. They will likely take x-rays at least once a year or more if you're having any issues. After you see your dental hygienist, you will usually see the dentist, who will check out all your teeth and make sure that everything looks great. Here are some tips and tricks to a healthy mouth. After eating or drinking something more acidic like tomato sauce or lemon juice or lemonade or orange juice or coffee, you should wait 30 minutes or more before brushing your teeth, since brushing too soon after that could wear down the enamel on your teeth. Brushing twice a day is all that you need to do. If you brush more than that, you can also risk wearing down the enamel on your teeth. You also run the risk of irritating your gums if you brush too vigorously or too often. You should definitely limit your sugar intake. I know it's unrealistic to say that we should eliminate all sugar, but we can limit. Sugar will turn into lactic acid in your mouth and also will start to erode your teeth when it stays there too long. If you do eat something sugary and you don't have the chance to brush right away, or if you brush again, it's going to be too often, you should at least rinse your mouth with water, swish and spit, or you could choose some sugar-free gum. This one is super important. Quit smoking or using chewing tobacco. Not only are you ruining your teeth, staining them yellow, and putting yourself at risk for bad breath, but you're also putting yourself at risk for oral cancer. It's important to note that we all have different oral health needs. Children should start seeing a dentist at least by their first birthday. Babies should be bottle fed at meal times only, and they should never be put to bed with their bottles. Bottles full of milk can pool in their mouths, and that can cause tooth decay. Babies should be transitioned to a sippy cup by 1 year old. Dentists will also probably put sealants on your child's teeth at some point to help protect them from cavities. For men, they are less likely to brush and floss as regularly as needed. They are also more likely to develop oral cancer. Men with gum disease are more likely to develop other cancers as well. Women have different oral health concerns. During menstruation, they might develop sore and inflamed gums or mouth sores. During pregnancy, there are a lot of hormones at play, and they can develop gingivitis or gum disease. Morning sickness can cause vomiting, which also potentially can cause tooth decay from stomach acid reaching the mouth. And during menopause, women have an increased risk of gum disease because of decreasing estrogen levels. There are so many barriers to oral care. Ethnicity, employment, amount of education, lack of health or dental insurance can all have an impact on the kind of dental care that patients receive. According to Monin, about 3/4 of cavities occurred in only 1/3 of the population. This population included Blacks, Hispanics, Native Americans, and low-income patients. Low health literacy is a huge factor in non-compliance with home oral care and regular preventative dental visits. A study done on Hispanic patients revealed a lack of Spanish-speaking dentists or hygienists had a negative impact on their oral care or dental visits. About 30% of the Hispanic patients surveyed believed that they could brush away cavities. Almost half of them had no dental insurance. It is so important that we work through all of the different barriers and try to reach all of our different cultures to convey just how important oral care is and what that means. So what do we have to do at the very basic level to keep our mouths sparkling? First, we need to brush twice a day. In the morning when we get up and at night before we go to bed. 2, we need to floss once a day. If you're more likely to do it in the morning, pick that time. If you're more likely to do it before you go to bed, then make that the time that you floss. We can use sugar-free gum and or mouthwash to help us even more. We need to get a professional cleaning twice a year. And of course, go to the dentist right away if there are any issues with your gums or teeth, or if you notice anything abnormal in your mouth. Let's work together and encourage one another to have the best oral care we can have and have a healthy mouth and a healthy life.